How do you calculate your fertility window? Now, this is something which is common, and this was asked by many of my patients, and many of my coaching clients would ask the same, especially those of us who are either trying to have a baby or those of us who are trying to avoid having a baby, right? Because if you abstain during this time, the chances of you not getting pregnant are higher, or if you have sex during this time, chances of you getting pregnant would be higher. Did I say it right? Okay. All right. So basically, every month we release an egg, ideally on say 13th or 14th day of our menstrual cycle. For this is typical for those who have a 28-day cycle. So there are many of us who don't have 28-day cycle. Some would have 26 days, some would have 30-day, 32-day, 35-day, and that's consistent, right? And you can make out that you're ovulating with a slight pelvic pain. Depending on how sensitive you are to pain, you might experience. Some people are very sensitive and it troubles them, this pain, and some are not sensitive to pain, so they will not even notice it. So when the ovulation happens, there's a slight pain which happens in your pelvic area, and that means you have released the egg at that time, and it will be alive for 24 hours. So if you have a 28-day cycle, this means 14 days before your period came, you have ovulated. So no matter what is your cycle length, you ovulate 14 days before your period. So if whatever time you ovulated, you're not pregnant, you're gonna get your period in 14 days. So it's something like that. So if you have a 26-day cycle, subtract 14 from it, it would be 12. So you are ovulating on 12th day. Suppose you have a 27-day cycle, subtract 14 from it. So 27 minus 14 is 13 days. So you're ovulating on 13th day. If you have a 35-day cycle, subtract 14 from it. That means you're ovulating on 21st day. So this varies, right? Like some people would have 28-day cycle, then 32-day cycle, 35-day cycle. We don't know whether you're ovulating that month. Maybe you're not, but maybe you are. So keep an eye on those, like suppose you don't have irregular periods, then just observe if you get any pain anytime in the month, and just keep a track on that. Also, when you're ovulating, you are your libido is slightly higher, so you would be a bit horny. Also, there will be a slimy discharge in the vagina, which is not like your usual vaginal discharge. If your vagina is like overall dry most months, during ovulation it will be slimy, right? So that's how you will know if your fertility period, 14 days minus your period cycle length. Also, the egg lives for 24 hours, but the sperm can live inside for 3 days, and nowadays they say 5 days. So suppose if you have a 28-day cycle and you ovulated on 14th day, that egg is going to live for 24 hours. But if you have had sex, say on day 10, day 11, that sperm might still be alive and inside your uterus and ovaries, around the ovaries to fertilize the egg. So they are very connected that way at a very primal level. So the sperm will always wait around the egg if it feels there are some release of pheromones that the egg is going to release. So that's how you will come to know your fertility period, 14 days before your period date, and like plus 5 days before. So 14-day period. So from 9th day you can like start having sex, at least alternate day, so that there is always sperm around the egg, and you can stop having sex once you get that pain. Like maybe after 2 days you can stop having sex if you're not interested. I mean, you can listen to your body and your body will always guide you. All right.